We got this breaking news from Timcast.com. Biden's vaccine mandate for businesses blocked by the Supreme Court. The court wrote the Occupational Safety and Health Administration was not permitted to broadly regulate public health. I agree. I think they're correct. They wrote, requiring the vaccination of 84 million Americans selected simply because they work for employers with more than 100 employees certainly falls in the latter category, where they said, although Congress has indisputably given OSHA the power to regulate occupational dangers, it has not given the agency the power to regulate public health more broadly. The dissent, I find actually kind of humorous. In the dissent, the liberal justices wrote, because it really was split 6-3, when we are wise, we know not to displace the judgments of experts acting within the sphere of Congress marked out and under presidential control to deal with emergency conditions. Today, we are not wise. In the face of a still raging pandemic, the court tells the agency charged with protecting worker safety that it may not do so in all of the workplaces needed. As disease and death continue to mount, this court tells the agency that it cannot respond in the most effective way possible. Well, there it is. And the Daily Wire is doing a victory lap because they were leading the charge on this. They were, I think they may have been the original lawsuit. I'm not sure. Yeah. But here we go. That's it. Joe Biden's out. No vaccine mandate, right?
I think Brandon wants to be a dictator, so this is definitely a step back for him. But he's also urging businesses and states to still implement this on their own. I'm surprised he wasn't begging the Supreme Court just to censor all the arguments here against his vaccine mandate. This is a major blow against his agenda, against the narrative. And thank goodness we don't live in a country like Canada or Austria or Australia where people are literally being robbed of their wealth for not complying with the whims and medical advice. And then still, by and large, it's still crazy. I bet you probably agree with this too, Matt, that we have to be in a place where, some mystical figures in robes decided that we could decide what medicine to take for ourselves. That's where we're at right now. That's crazy.
It was insane, and I was freaking out today because earlier in the day, everyone expected this to come out, and then they released some other nothing burger decision about something that I don't even remember what it was. And I'm like, oh shit, are they going to punt for a week? And happily they did the right thing. But the absurdity, and even listening to the more conservative justices arguing that it would be okay for a state or someone further down the food chain, a different government official, to then impose on you this mandate that you have to take this vaccine. I'm of the old school where individual freedom and freedom of conscience is actually a real thing. And I thought that's what America was. But yeah, we dodged a bullet today, and that was a cool thing. I ascribe to a theory that Thomas Massey introduced me the day that Joe Biden announced this. And you remember they dragged their heels on the rule. And Massey's theory was they know it's unconstitutional. They know that they're going to get shot down. But in the meantime, they're going to bully as many businesses as possible into complying with this. And I feel like Biden is proving that theory today.
You can't unvax.
Yeah.
And so what happens is a ton of businesses, when they heard Joe Biden issue his press conference, which was not even an executive order, they just went, okay, everybody, you got to do it. You heard Joe Biden. And then people were basically mandated to do it. Now they went and got vaccinated. They come back to work and the company goes, hey, everybody, it's off. We actually we don't have to do this. Too late.
Yeah.
So I think that was the plan from the get-go.
And I feel like, and maybe we'll get into this in a different context, but I feel like if you were forced to get vaccinated, maybe secretly you want to kind of force everyone else to do it too, because you're pissed, like you got sold a bill of goods.
Yeah, I certainly think that's true. I mean, you take a look at, we talked about this last night. Vaccine mandates don't work. And when I say they don't work, what I mean is in New York City, I think they had the first vaccine mandate. They have skyrocketing COVID cases. Right. So whatever the point of this policy is, it's certainly not stopping or abating the spread of COVID. But yet still, you hear these Democrats and these city politicians say it is working. Why? It's forcing people to get vaccinated. It's not stopping COVID. It's just forcing. They call that working.
Yeah.
So it sounds to me like they're like, I don't care why you do it, just do it. I don't care what the results will be, just do it.
The culture of compliance, right?
Yeah.
That sounds like extortion to me, just a little bit there. But there was also another ruling specifically with healthcare workers at facilities who are receiving Medicare and Medicaid funds, which was ruled against them, which means that people who are working in these facilities will have to take the vax or lose their jobs at a key time where already Seattle and Los Angeles hospitals there have announced that if they have nurses and doctors who have tested positive for COVID, that they need to come back into work.
Yep.
That is absolutely insane. Seattle and Los Angeles also implemented vaccine passports for their employees in the medical staff. And now we're having COVID positive patients, COVID positive nurses and doctors literally go back to work dealing with other people inside of hospitals, all in the name of what? Safety and security and health? Yeah, sure.
Well, think about Medicare and Medicaid. So Medicare serves seniors over 65 who would be most vulnerable to COVID and most susceptible to ending up in the hospital. Medicaid, of course, serves poor people. So the effect of this, most hospitals take these programs, but some don't. But the effect of this is to specifically understaff hospitals that are serving seniors and people that are struggling to make ends meet. Mm-hmm. That's what they're doing. This is how government works.
They're using government health care now and telling people they're going to take away their health care if they don't follow the government's orders.
Well, the logic was if we're paying for it, we being the federal government, we get to tell you what to do with your body.
Exactly.
So welcome to government-run medicine. This is how it works. They own you, and they decide what you do have to do, but they also decide what you don't get to do. Like Joe Biden has nationalized monoclonal antibodies.
Yeah.
Oh, when did that happen?
Now they're trying to shut that down, I'm hearing.
Yeah.
So I was actually recently told by a medical worker that they were told monoclonal antibodies no longer work and that they're not to recommend them. And that to me is insane. What?
Yeah.
Well, that's just me personally. Look, I'll tell we always tell everybody we're not here to give medical advice, and that's like a big topic because of so much of what's going on in the pandemic. Yeah. Go talk to a doctor and see what they say about it, because I'm being told that they're starting to pull monoclonal antibodies.
Well, I had a friend who was sick with COVID-19, and they were having a very serious case of it. Some of the early preliminary data is highlighting how some of the antibodies don't work, but there is one specific antibody that does work with Omicron. But for Delta, a lot of them do work by a broad basis. This is just again some of the preliminary early findings. I'm not a medical doctor. I'm not here giving you any kind of medical advice, but it has been siphoned off. And my friend who was trying to get antibodies for herself and her husband because they weren't doing too well was told because of Biden, because of the governor in New York, you can't get them. And there was even an article in the Daily Mail that said whites need not apply for critical COVID care, for antibody care, because of their skin color, as of course they're also passing laws in many places, like in New York, where if you were born a specific skin color, you're denied access to medicines compared to other people because of their skin color.
Remember death panels?
Yes.
I mean, yeah. What was that? That was back in like 2008?
That was like fear-mongering techniques of Obamacare, that there's going to be government-run health care and the government's going to decide who lives and dies. That was that was the story.
It's not wrong.
Was that wrong?
It's exactly how it works. And,
Yeah.
and I know this very personally. My wife, Terry, got COVID over Christmas. And, okay, I'm going to get monoclonal antibodies, and it turns out that they pulled 2 of 3 types of monoclonals off the market. The Biden administration did, because the assumption was they work on Delta, but they don't work on Omicron. And so they pulled all of these things away from the hospitals. So in our case, we couldn't get treatment for my wife. She's fine now, but she would have done better with them. And then it turns out that, we thought it was all Omicron, but it's not really all Omicron. There's a lot of Delta out there.
Yep.
And it's sort of a lesson in how single top-down decision-making works in government. They just arbitrarily said, you know what, it looks like Omicron now. Well, it wasn't. And catastrophically, someone at the margin probably died because of this government decision. We don't know who that is, but someone could have gotten treatment, and some bureaucrat in the Biden administration said, you know what, we're not going to let you.
Yeah. I think there's no one here who's a fan of centralized command control, economic structures or governmental structures, right?
No.
In the military, so when it comes to military,
Ian's like, yes.
When it comes to military, I understand the need for authoritarian top-down generalship.
No, that's a fair point, though. I agree with that.
Yeah.
That's why we have an executive structure, because when we got to move fast in emergencies, it does make sense. But we're at this point now where too much is being absorbed by this executive authority. It can't be total control of our medical system in one place.
The FDA is also intercepting packages with medicines that some people are using to help treat this. So when you have the government outright intervening in such egregious ways, and you see the result of it with more people being hurt, it really, really should leave a lot of people with the questions, what are they doing here other than making the situation that much worse for everyone else?
As you said, the FDA was intercepting
packages with specific medications that have been a big topic of debate. Obviously, these are the medications that Joe Rogan has talked about before. I don't even want to name them because of the kind of hot button.
I came across a video on Twitter where apparently there's been a bunch of thefts of train packages in LA. I don't know if you guys saw this on the scanner. They heard about it and they went down there and it's like just ripped open packages of Amazon packages, boxes, COVID tests, fishing lures, EpiPens.
Crazy.
Is it piracy? Is it?
I don't know.
This
But,
is what crossed my mind
anyway-
as you were saying that. Are people being privateering these stuff?
Back
Probably
to what we
not,
were talking
but-
about. I wanted to get back to that point about executive authority and the need for emergency response. My view of emergency response is there's an agency that says, okay, we're going to go to these local communities that are affected by a pandemic and ask them what they need. And we can do that very, very quickly because we have the authority to respond rapidly. But not to dictate what the communities have to do, not to go to local mayors and say you're now mandated to do this. So when you look at, here's what I love about mask mandates especially. We work on the border with Frederick County and I think Washington County in Maryland. And so you can walk 10 feet and there's a building with a mask mandate and then walk 10 feet and there's one without. And it just literally makes no sense. And then the crazier thing is the further out you get from the center of the county, the less likely you are to even experience the mask mandate, which it just does not work. But then they want to start punishing businesses and fining them. And it's just like, look, being able to rapidly respond to a crisis by showing up with resources, you can spend money, you have people working under you and you can say, here's what needs to be done. Makes sense. But if you go to a community, you ask them what they need. You don't tell them what to do,
Yeah, I mean that's the dream, but the problem is there's a fatal conceit when you give these guys that much power. They have their own theory about how to do it, and the most disturbing example of this we all know is Andrew Cuomo overruling nursing home providers,
murdering 15,000 people.
He probably thought he was doing the right thing. He probably thought he knew better than them. And the problem with governments using local knowledge is that arrogance. They don't want to cede the fact that they don't know because that's political danger for them.
I disagree with Andrew Cuomo not thinking he was doing the right thing, though. I understand your point, and I agree with that. But Cuomo had the Mercy medical vessel, and he had the Javits Center. And he was like, I'm not giving Trump a victory. Kill the old people. He was warned. Cuomo was warned. If you do this, you will kill old people. And he said, instead of using the Javits Center, which is only at a third capacity, or the Mercy vessel, which isn't being used at all, I'm going to kill the old people. And he did.
Or the Central Park Hospital that was there that had
right.
received no one. I mean, you could even facetiously say that he was on the phone with his brother at CNN being like, hey, we need more of those deaths to boost up ratings. as of course, there's CNN officials literally bragging about how they were happy, how more people were dying because it was gangbusters for ratings, which is absolutely absurd. So again, that's facetious. It's sensationalistic to say that, but it's not out of the realm of possibility with how they've been behaving.
Man, this is the kind of stuff that makes me want to do sketch comedy because you can't do it on YouTube, but you'll be able to do it on Rumble.
Yeah.
Where you just have Chris Cuomo call up Andrew and he'll be like, Chris, my show's not doing too well. We need more deaths. What can you do for me? It's like well, little brother,
I got you.
I got you. We'll just kill a bunch of old people. It's meant to make fun of them for as bad of people as they are, but Andrew Cuomo knew what he was doing, and people come out.
It was standard protocol. This is why there's such a big kind of talk about conspiracy of him being outed, because if he got hit with that, if he was responsible for that, so would a lot of other Democratic governors in Michigan, in New Jersey, who would have been held responsible for it. And that's why there's conspiracy talk of Andrew being kind of taken out, so there wasn't any kind of possibility of him facing any justice for that specific cause, because it would implicate all these other governors that were Democratic, that were following orders from the federal government that was telling them to do this.
Thanks for checking out this segment from the Timcast IRL podcast. If you want to watch live, you can check out this channel Monday through Friday at 8 p.m. Now, don't forget to smash that like button, subscribe to this channel, and if you want more unfiltered and uncensored content with all of these guests, go to timcast.com and become a member. all of these guests you know and love in exclusive segments on our website where we are unrestricted in what we talk about. So you'll definitely not want to miss it. Thanks for hanging out. We'll see you all next time.